Hey guys, I just wanted to take a couple of minutes and talk to you guys about x-rays and the importance of x-rays in the office and what they allow us to see and how they help us to customize your care here in the office, okay? So x-ray, number one, just want to start by reminding everybody that when we're talking about chiropractic, when we're talking about your care, the adjustments, and most importantly, the way that your body heals and functions, we're not really focused so much on the bones, although that is what we see in an x-ray. What we're focused on is when those bones shift out of place, they begin to exert pressure onto the nerves and the nervous system, especially up here at the top part of the spine in an area called your brain stem and the cervical spine. So essentially the way that this works is the brain sits on top and it sends signals down the spine. So when these bones are in their proper alignment, those signals can move through the spinal cord at 100% and make it out to your body at 100%. What happens is when these bones shift out of place, they actually begin to exert pressure onto the nervous system right up here at the area of the brainstem and then throughout the spinal cord as well. So that shift begins to exert pressure onto the nervous system and it literally blocks that good flow of communication from the brain out to the body. So when we're looking at a new patient and dealing with our patients on a day-to-day basis, we need to know exactly where these bones have shifted in the cervical spine. So when we're looking at the nervous system, when we're looking at the spine, there are normals and they're measurable. There's a measurable positions to these spinal bones and where they're supposed to be. So when we're doing a new patient examination or we're doing a reevaluation with a patient, taking an x-ray gives us a perfect visual as to how those bones are sitting. A lot of times we get the questions of, hey, do I really need to have an x-ray? And the answer is yes for most people, because seeing is knowing, okay? When we see the spine, we know where it is, we know what bones have shifted, we know how much damage there is, and there's no guesswork there. It allows us to know whether or not you actually do have pressure on the nerves and the nervous system, and then the best ways to correct that pressure for you, an individual patient. So if you have any questions, obviously let us know. Give the office a call, schedule a consultation, and drop a question in the comments, and we'll do our best to respond to everybody. Thank you guys so much.